Hi everyone, welcome back to MD-VOD, where today we're talking about urogynecology, and we're joined by expert urogynecologist from Marina Del Rey Hospital, Dr. Amy Rosenman. Amy, thank you.
Thank you.
We're going to answer your questions live on Facebook and Twitter. The first question up is, can you tell us how the specialty of urogynecology is growing?
Well, as
and evolving.
I may have mentioned before, it's both urologists and gynecologists. It's now going to be a board-certified specialty starting in June with a new name. It's going to be known as Female Pelvic Medicine and Reconstructive Surgery, or FPMRS.
I was going to say FPMRS is way easier.
Way easier. But essentially, it's because it's a multidisciplinary specialty that the names are being combined, and urologists and gynecologists are both specially trained and qualified if they have the special training to do this kind of evaluation and treatment.
So it requires tons of training, and
it does. It requires completing a gynecology residency followed by a 3-year fellowship. That's 4 years plus 3, or a urology training, which I believe is now 5 or 6 years plus 2. So it is a lot of training.
Wow. One of the, we talked earlier about the procedures that you do, and you talk a lot about the pelvic floor. It seems like that's sort of the problematic area.
Yes.
What is the anatomy of the pelvic floor?
So let me try to give you a general concept. We're all aware of what the pelvic bones look like. It's like a basket that surrounds our pelvic organs. You can also think of it as, I think a basket is the best way to think about it. And lining that basket are the pelvic floor muscles. We have muscles on the sides of it, we have muscles in the back, the front, and the bottom. Now through those muscles have to go our rectum, vagina, and urethra, so that we can have childbirth, sex, and elimination. And those areas are the areas that are in flux, shall we say. When those areas are moving out of position and are no longer in the proper alignment, we have problems with the pelvic organs dropping, and urinary and sometimes stool incontinence.
So the floor of the basket, if you will, where all those organs come together.
It's
the
thinning
urethra, the vagina,
and sagging.
Oh, interesting. Huh. That's a great
and
way to
then
describe
it allows some things like the bladder and the uterus to actually slip through.
Wow. Next question up is, when would you use robotic surgery to correct some of these problems with, that arise in urogynecology?
It's actually the most exciting question, because this is the new age. Being able to use the, there's a new Da Vinci robot at Marina Del Rey Hospital, which is just wonderful. And now we can do an operation that we've done for the last 30 years with a big incision. Now we can do it with a tiny incision in the belly button and a couple of other 1/4-inch incisions. So this has taken a tried and true procedure that we have lots of safety information on, that does use mesh abdominally, like we have been doing for 30 years with very good results, and it allows us to do it in a minimally invasive way. So this is a paradigm change. It was always the best, strongest repair to do a mesh sacrocolpopexy, or attachment of the prolapsed vagina behind the pelvic structures to the bony pelvis. But it was a big operation with a large incision. That didn't appeal to too many women. They'd rather bulge, they told me.
Wow.
But now they can have the best of all worlds, a good, strong repair, minimally invasive with a Da Vinci robot at Marina Del Rey, where we have a new one, which is, I can't tell you how important that is, because the newer models are much more facile at doing these things than some of the older ones.
And you mentioned, this is a question I have, because it's so exciting, the technology is incredible, and your field has grown to be its own entity because of technology. A lot of it has to do with technology and what we're learning about the pelvic floor and how to fix it. The robot, it's interesting because laparoscopic surgery, let's say for a hysterectomy or some of the other surgeries you do for the pelvic floor, it seems limited because you have sort of these crochet-like needles, which is great because it's a smaller incision, decreased length of stay, and cosmetically better.
Yes.
But the robot's neat because the arms spin around and turn. And can you tell us a little bit about why that's
right? Instead of a straight thing, and you're trying to do sewing in this kind of a arrangement, you have wristed instruments that move just like hands do. So you can put in a stitch in an upside down location, and you can tie it
Wow.
like you would normally tie it. So it's really a major boon. And the other issues are that you can sit in a comfortable position, so you're not contorting yourself, which limits how long you can do a procedure. And it appears that the learning curve to become an excellent robotic surgeon is shorter than the learning curve for laparoscopy. It takes years and years and years, whereas
Wow.
with the robot, once you get along, you can learn to do a lot more quickly. So it may be the paradigm of the future. It will bring minimally invasive surgery to a lot more women because there are very few people with the laparoscopic skills to do these procedures without a robot.
Wow.
Now, I have done them with without a robot, but it's actually physically painful to contort yourself for hours at a time.
And the robot is available where you work at
Yes.
Marina Del Rey Hospital.
Yes, it is, and it's really made a change in what we have to offer our patients. It's a wonderful thing. They go home either the same day or the next day.
That was a great review. I want to thank you so much, Dr. Amy Rosenman from
Yes.
Marina Del Rey Hospital, telling us all about urologic gynecology. If you missed any of today's show, make sure you go to MD-VOD at emPOWERme.tv. That was a great review. Thanks a lot for your questions. We'll see you next time. And now, for any episodes you might have missed, they're available at the emPOWERme.tv website and the YouTube channel. And be sure to leave us any comments and questions so that we can better help you deal with your disease. We'll see you next time on MD-VOD.